Focus on Health, information for better living on KPLCTV.com.
Knee ligament injuries are common in all sports that involve cutting or jumping maneuvers. Knee ligaments are structures that provide stability of one's knee joint. There are four main ligaments that provide stability to the knee. They are MCL or medial collateral ligament, lateral collateral ligament, and posterior cruciate ligament, and anterior cruciate ligament. The medial collateral ligament and lateral collateral ligaments are collateral ligaments on each side of the joint that keep the joint from opening up sideways. The anterior cruciate ligament and posterior cruciate ligaments are ligaments that keep the knee from moving too far forward or too far backward. Injuries to the medial collateral ligament and lateral collateral ligaments usually don't require surgery. Treatment for these injuries is usually a short period of immobilization in a controlled knee brace and rehabilitative exercises. An individual can usually return to sport in anywhere from 3 to 6 weeks depending on the severity of the injury to these ligaments. An injury to the posterior cruciate ligament can be treated in a similar manner unless there is an associated injury to one of the collateral ligaments. If such occurs, then surgery is usually needed to repair the ligaments. Injury to the anterior cruciate ligament is the most common athletic injury of the knee that requires surgery. There are about 150,000 anterior cruciate ligament injuries that occur in the USA. The anterior cruciate ligament cannot be repaired, and it's necessary to reconstruct this ligament using other tissues. The most commonly used tissues to reconstruct the torn anterior cruciate ligament are the middle third of the patella tendon, the hamstring tendon, the distal quad tendon, or cadaver tendons. The middle third of the patella tendon is an excellent graft, but there seems to be a higher incidence of anterior knee pain and pain when one kneels. The distal quad tendon, which is this tendon here, is an excellent graft in that it is strong and has a very low incidence of problems associated with its use. Hamstring tendons, which are on the side of the knee joint, are excellent grafts as well. However, there's some variability in their size, in which limits their use, as well as there seems to be a slightly less stability to the knee as compared to the middle third patella tendon and the distal quad tendon. Cadaver tendon grafts are most often used when there are multiple ligament injuries. These incorporate slower than the person's own tissue, and there's a low risk of disease transmission with their use. No matter what graft is used to reconstruct the anterior cruciate ligament, a period of 6 to 12 months and sometimes even longer is needed for the graft to incorporate and gain the needed strength to return to sport. In order for us to determine when an athlete can return to sport, we are using functional testing.